raise your hand throughout the presentation. We will keep everyone muted until the end when we will open up for questions. We have quite a few speakers today, so we want to be able to stay on time and stay on task for that. Throughout the hour, again, you will have questions. We realize that, so just place them through chat and then we'll address those at the end. Sarah Watts, our VP of Workforce and Community Participation for the Gilbert Chamber, will be reviewing your questions in your chat and keeping up with you through that process. And before we begin, I certainly want to acknowledge Sarah, as well as Melanie Dykstra from the town of Gilbert and the Chamber of Gilbert, as well as the Chamber of Mesa, who have really helped to move us along with these town halls, help with organizing and operating, so to speak. So we're very much appreciative of that. One of the purposes of the town hall is really to address topics that you have brought up, both in the survey that we put out originally, as well as during the discussions at each series. We have different topics that come up of interest of the group, and so then we bring those forward in future calls. So for today's call, we have mental health of nonprofit employees, domestic violence overview and the impact on the community, especially during this time, and volunteerism, the current challenges and opportunities. As it relates to those topics, we have a lot of different speakers who will be helping us today, and I'll be introducing them as we move through the process. And I want to make sure I don't forget to thank each of our speakers today. I'd like to introduce our first speaker today, Angie Geren, who is the Executive Director for Addiction Haven, to present on the resources for mental health in her peer-to-peer support program. And Angie, we are ready to begin whenever you are.
Hi, Kathleen. Thank you for having me here. I am actually up in Idaho right now at my parents', so I'm in a coffee shop. If there is some background noise, I'm sorry about that. But thank you for having us present. We just recently started our peer-to-peer program with Dignity Health, and we were, initially looking at the SAMHSA's program of Zero Suicide. They have an amazing initiative that really looks at prevention more at an intervention level once they are already in a hospital system and are coming to the ED. And what we did as the community partner, we changed our name to Arizona Recovers last year from Addiction Haven to intentionally show that we focus on our solutions and that there is hope. And with that, created a program called Brave Connections, which is our peer-to-peer program. Originally, before COVID, we were going to go into the ED, but since that's not available now, we've transitioned to virtually being able to connect with the people that are in the ED, whether they struggle with depression, anxiety, suicidal ideations, or post-suicide attempt, understanding that when we come into an ED with depression or anxiety, it's great to have those resources that we're able to get, but there's not a lot of care because we don't kind of qualify for that next level of care. And there's that large gap that we're seeing in that system of care. And so as a community partner, we're able to come in with a peer support and connect with that person in that ED, so that way we can work on things like building a resiliency plan, adding additional community supports, increasing family supports, increasing their natural supports that they have at home, and also having somebody who understands, because they've been there, of what they're struggling with, help encourage them to go to follow-up appointments and really look at ways that we can build that supportive network with them, because the risk of suicide post-discharge from the ED within the first 7 days is like 70% higher. And 70% of those who have a follow-up appointment scheduled from the ED never actually make their first outpatient appointment. So being able to kind of bridge that gap of care there. So hopefully we can, catch them before it goes into something more permanent.
Thank you so much, Angie. I'm really impressed with how you have been able to move from what would typically be an in-person interaction to the platform of virtual care, so that you on the call know that we had to change the game, so to speak, obviously, as Angie mentioned, with the COVID crisis, to be able to still get those patients into services. Angie put a lot of time into training our care coordination team on how to get those referrals and how to use an iPad with the interaction with the patient to get them into those needed services. And obviously, with 70% not making their first appointment, then we can greatly increase their first appointment, which will then decrease that large percentage of those who attempt suicide even after the ER. So that's what I would tag as disruptive innovation during this chaotic time. So we're appreciative of that. And again, to what you alluded to, that suicide was a problem before COVID-19, and it's even a bigger problem now. And I think the same will be said, I'm sure, with Jessica and Keith as it relates to domestic violence. So we're appreciative of these programs and opportunities. Is there anything specific you want to share with the group before we move to the next speaker in regards to how they can get their clients as a part of any of the programs that you run?
Yeah, so we have, so Brave Connections has two separate tracks. We have a substance use disorder track, and then we have a mental health track. So they focus on a few different things, but mostly the same, because building supports and building resilience, and identifying, you know, the root causes are definitely the same across the board. I think we all understand in this field that it's really not one or the other, and that they tend to all work together. ArizonaRecovers.org. We have information on our program. My website is going through an overhaul. It should be up with our new and improved later today. Or just contacting me at Angie at ArizonaRecovers.org, and we can connect your client with services.
Thank you so much. The information is so appreciated and so important at this time, as I mentioned earlier. Next, we have Keith Bradshaw, Counseling Manager for the Gilbert Police Department, to present on One Gilbert to reduce teen suicide, but he will also talk briefly about the impact of domestic violence in the community. So Keith, whenever you are ready.
Thank you, Kathleen. I really appreciate this opportunity. I think this is a great forum for all of us to come together, and obviously we're going to empower each other as we recognize what we can offer and the things that we're doing. As mentioned, I'm Keith Bradshaw, the Counseling Manager for the Gilbert Police Department. I've been there about 12 years. And just a little bit about our agency. We're pretty unique because we are licensed under the Arizona Department of Health Services to provide screenings and counseling. We actually are a jack of all trades. I have 6 independently licensed counselors that I supervise with an admin, and we're primarily doing court-ordered screenings for defendants who receive misdemeanor charges, from DUI to domestic violence. We monitor their compliance, we refer them out for treatment, and then send our reports to the judges. We also do a lot of first responding for any situation related to victimization. So a lot of death notification, we see a lot of suicides, anything related to someone passing, to sexual assaults. So that keeps us busy out in the field, supporting the officers and the community. And we also run diversion programs for the kids who get in trouble at the school level or through our officers. And we run several groups to help them complete that program and get back on track. Domestic violence is extremely important to us. Back in 2012, we had a situation that really made us reevaluate how we approach domestic violence in the town of Gilbert. And because of that, we've kind of put together a task force. We now work very closely with the family violence detectives and their sergeant. And one of the main things that we do there is we receive a report every day at 8 a.m. for any domestic violence incident that has occurred. And we evaluate that, we assess it, particularly for lethality, and we will outreach the victim within 24 hours to get them the support that they need. So those are some of the things that we do. But like I said, we're pretty unique in that we do many different things in supporting the community. For us, I think as clinicians, as nonprofits here in the community, I think it's important that we understand that we are the first responders providing psychological first aid. And so we need to understand our role, how we collaborate together, the coordination of care that exists between us. And for us, it's critical just because we have a lot of people moving in and out of our office who are engaged in treatment or counseling. And so that collaboration is certainly important to us. One of the things that I like to highlight, I'm also a part-time therapist with Redemption Psychiatry. And so I take a cognitive behavioral approach to things. And one of the things that I like to do, particularly with the youth that I work with in our diversion programs, is highlight how we need to shift our paradigm. We need to see things from a different perspective, and understanding our role in the totality of the vision that we need to have really helps us understand the specifics of what we do each day and how we're trying to get there. One of the things that I've been able to participate in with Kathleen and others is the One Gilbert initiative that has been put together by our Gilbert mayor. And we have brought together many stakeholders from the community to collaborate on the issue of mental health as it pertains to youth, particularly emphasizing, what we can do to help decrease or reduce the suicides that have spiked here recently. And so being a part of that has allowed us to really start to understand each other in terms of how we all are trying to contribute to the success of that endeavor. I'm going to have some things posted here for you to view, but one of those is a video that the youth actually put together. It's called MIAC, the Mayor's Youth Advisory Council. So these teens put together a video that they posted on Facebook. And so you'll have the link to that shortly to be able to view. And working with the teens is challenging because you really have to understand where they're coming from. You have to understand the challenges from their perspective. And, we have a wide diversity of stakeholders that are engaged in One Gilbert, from Kathleen and Dignity Health down through the school districts, nonprofits and faith-based organizations, and first responders represented by myself and fire. So as we come together and talk about these things, we're realizing that this is a significant challenge. And we've only seen this increase now with COVID-19 upon us, and still continuing right now. We've seen large spikes in situations that normally wouldn't happen. For example, over Memorial Weekend, we had 15 domestic violence cases come through that weekend, all of them high lethality through Gilbert. And so, our counselors stay busy trying to outreach those victims. We work closely with some of the nonprofits out there, Winged Hope with Jessica and her people. So it's just important that we understand how we come together to tackle these issues. I also want to post a link here for your viewing from the Battered Women Justice Project. It's a 7-minute video about how COVID-19 has impacted domestic violence victims. And it really goes into detail using the power wheel to help us understand how it has been even more exploited through the COVID-19 and the stress and the anxiety and the circumstances socially that's related to that, in terms of how offenders are continuing to perpetrate and elevate their tactics against victims. So if you look at that, and if you go to that website right above the video, you're going to see a link to a PDF to download the Power Wheel, and it goes through it and breaks it down in terms of specific to COVID-19. I would encourage you to do that and really understand that, particularly the spoke on the wheel related to isolation, and how even us who aren't engaged in any kind of domestic violence are feeling very isolated at this time because of the social distancing and other directives that have come for us to maintain health and safety, while at the same time offenders are continuing to exploit that and victimize their victims. So this has been a challenge for us. My whole department went remote. The town buildings closed down and they're now reopening. But during that time, it's tough because we've had to adjust and adapt how we do things in terms of going to telemed, versus face-to-face. So like you guys, we experience our challenges, but we also are optimistic and remaining positive about how we can help victims and those members of the community really deal with some of these stressors that are pretty significant at this time.
Yeah.
I guess just to conclude, it's just important that we are remaining engaged, and if I could highlight one thing, just the importance it is that we have to work together to communicate and to coordinate that care with each other so that we understand what's offered, the services that are provided, and matching the needs of those that need them to what they can get.
Right. Thank you so much. Again, very relevant, important information. I really appreciate that you talk about the importance of collaboration. I think as a community, the more that we're able to work together and look at cross-sector opportunities, the better we're going to be able to serve the individuals in our community, regardless of their circumstances. And I think your partnership with the first responders is so important. That's great teamwork to address both the situation with the first responders, their role in that, and then the counseling perspective becomes so important because there always has to be some level of follow-up, and your ability to do that in a very timely manner as a part of the team is so essential. And also the discussion on the teens, we can't ignore the significance of the impact of life in general for our teens. The increased suicide rates tell us that, but now with the COVID, even more so for them as they're dealing with the differences in how they would normally attend school and be with their friends, and even the home environment. Everything is so much more challenging. And so the ability to address through one suicide, to have a comprehensive collaborative approach to that is so important. And finally, I did want to touch base. I heard on the way here this morning on NPR about domestic violence and the escalating cases of domestic violence during this time of isolation for so many folks. And so it is such an important topic to address. So thank you again for your information. We appreciate it very much. And next we have on the agenda, Jessica Nicely, CEO of Winged Hope. Jessica is going to share her understanding of current challenges with domestic violence during COVID-19. And Keith alluded to her because Winged Hope is one of those organizations that is on the front lines of domestic violence for the victims. And this information will be very important. So thank you, Jessica. Are you ready? Jessica, we can't hear you. Are you ready?
Can you hear me now?
Yes, we can. Thank you.
Oh, perfect. So I was having technical difficulties and just found you all again right on time. So kind of indicative of how things have felt during these last few months. So we have definitely been affected by these times, and we have absolutely seen a surge in domestic violence cases. Those numbers have increased dramatically, but sadly our child abuse numbers have decreased. So usually we get our child abuse calls from churches, from schools. And so we've seen those numbers decrease, even though we know very likely those cases have not, because, you know, as everyone knows, during times like this, there's always going to be a surge in cases. So some of the struggles that we found is very often when we have a domestic violence case, we will help them get to another state or another town. And because of the restrictions in travel, we weren't able to get people to where they needed to go. So we found we were, at the very beginning of all this, especially trying to get people in hotels when we could. And it was definitely a big hurdle. And even just the most simple thing that we generally do right away is implement a safety plan for our victims. And we weren't even able to do that because unfortunately, like one of the #1 things we do in a safety plan is keep copies of all the important documents and things you need at a friend or family member's home or at your home office or at your church. Well, our victims weren't able to go to any of those places, so they weren't able to do that. So we definitely had to be creative about even how we structured our safety plans for our victims. The other hurdle for us has been that advocates haven't been allowed in court. So when courts did reopen and our victims are able to get orders of protection, unfortunately, we haven't been able to be there with them. So, so sadly, our victims have really had a lot of extra hurdles when they already have so many. So that has been difficult, and we have just relied on collaboration. So I saw some of the names in the list of those that might be on the call, like we've still been referring to Open Arms and Fans Across America. And so we've been really grateful that so many of the resources that we utilize have stayed open. Hope Women's Center, we've been collaborating with them. We've been still trying to get things to our family advocacy centers around the state. So we have been able to find ways to continue to collaborate. And to be honest, that's the only way we've been able to do anything for our victims, because we just had been unable to do it alone. So, and then I know you were talking about volunteerism. That's been a hurdle as well. But just recently we've started to see that people have been less afraid to leave the home. And so we have been able to do things like change locks again. And we've been able to get our volunteers out to change locks. So, and I don't know if some other people have had this, but we've had like resources that we've used for such a long time that sort of disappeared. And I don't know if it's because their business is no longer there, but like we had a locksmith we relied on constantly and we can't find him. So, so I don't know if it's just, you know, everyone's having their own hurdles and their own struggles, you know, in their own personal lives. And so I don't know if something's going on with him. So we've been reaching out to him, trying to make sure he's okay. Yeah. So we've, you know, it's just been such a multi-layered, I don't know, just juggling, I think, game for all of us. And I know mental health was one of the things we talked about. So our team has always been dealing with the worst of the worst. And, you know, every day we deal with these heavy, hard things. And the outside world has always sort of been our outlet and our escape. And now the outside world is also heavy and dealing with all this. So now there's kind of been no escape for us. So we've been really, really diligent about keeping tabs on each other, checking in with each other very regularly, and just talking to each other. Lots of communication to check in and see how everyone's doing. And especially with our law enforcement friends, because right now they're having extra challenges. And so we've just been, it's been a yucky, difficult. Extra yucky. Yeah. That's my professional term. It's been extra yucky.
Yeah. Thank you so much, Jessica. You're right. Yucky situation for everybody. I first want to say thank you for providing the services that you provide and for checking in on your peers and your collaborators. I don't think enough people think about how important that may be, just to check in and see how they're doing. And I thought you brought up a really good point about services that we typically rely on. We don't think about them no longer being available, but during this difficult time economically, the locksmith may no longer be there, or the other services that we would typically rely on. So that's very difficult. And also, I'm glad that you brought up the challenges as it relates to not just the domestic violence, but the child abuse as well. A reduced number of reported cases does not correlate to reduced number of child abuse cases occurring. And that's so that is very challenging. I will come around to you later in regards to this question once we get to the Q&A, but one question that I'll ask you to address will be how you've gotten creative in readdressing a different way of providing your services so that they can still continue even though you can't do them in person. And I do want to, if you can let people know how they can access your services, where you're located, and the contact information.
Yeah. So that's been one of the things we've been dealing with lately. We actually think we may move from our regular space because we haven't been utilizing it, and paying rent right now and funding is so low, hasn't been a priority because we haven't even been there. We've been doing everything virtually. So, right. And we still have the same mailing address, so that's the same, but you can find all of our information on wingedhope.org. And you can reach me at jessica@wingedhope.com. But Now we're still here. We're still taking calls daily. We haven't seen a decrease in numbers since this time last year. So, and again, since I know we've had a decrease in child abuse cases, that's how we know our domestic violence cases have increased and skyrocketed. But now we're still here. So, and what we've just been doing is coming to people when we can. We've been meeting people at the police department when we can. So, yeah. I can let you know further when you get to that part, but yeah.
Sure, thank you so much. And just to let everybody know, one little side note, Jessica was selected as Woman of the Year by Positive Paths, a nonprofit in the East Valley that supports women coming out of difficult life circumstances. And we do that through scholarships, mentoring, professional development. I am a member of the board, and we're thrilled to thank you for your service, Jessica, through this award, so thank you. Next, we have another talented and important person in our community, Katie Kahl, who is Executive Director of the Chandler Care Center. And I've been blessed to know Katie for quite a long time at the Care Center for many years, as many of our Dignity Health services are in her care center. And also over the past 3 years, Katie has been the Executive Director for the Chandler Children's Medical and Dental Clinic nonprofit that I am currently presiding as president. And so we work closely together in many formats. And Katie will share with us today some of the transition that she's done operationally as it relates to COVID-19 and some of the lessons that she's learned and some best practices and how she's moving forward. So thank you, Katie, for being with us this morning.
Hi, Kathleen. Thank you for having me. Can you hear me?
Can hear you just fine. Thank you.
Perfect. I'm going to share my screen. Give me just 1 second here. So as Kathleen mentioned, I am the director of the Chandler Care Center. And let's see if I can get this to work. Can you all see my screen, hopefully?
Yes, we can.
So I wanted to share just a little bit of information about who we are. And thank you for letting us participate in a Gilbert meeting, because although we don't work specifically in Gilbert, we obviously work with a lot of the same populations, and there's quite a bit of overlap. So the Chandler Care Center is actually a program of Chandler Unified School District. We started in 1995 at San Marcos Elementary School, which is right in kind of the heart of downtown Chandler. And in 2010, opened a freestanding building next to Galveston Elementary School, which for those of you who know where Chandler High School is, we're about a half a mile east of their location. Chandler High School tends to be an easy spot for people to recognize. So our mission statement is to promote student school readiness, attendance, and academic success. And we do that by providing medical treatment, social services, parent education programs, and referrals. And as Kathleen mentioned, in 2017, our medical and dental clinic actually became its own separate nonprofit. So we're still actually run the care center and then the nonprofit that's the medical and dental clinic as well. So it's quite interesting. Our services right now are listed on this slide and include basic medical services, hearing and vision screening. We are a family resource center providing programs and classes for families with children birth through 5 and also during their pregnancy. We provide free immunizations in partnership with Chandler Regional Medical Center. Free dental services, those are in partnership with both Chandler Regional Medical Center and St. Vincent de Paul's Dental Clinic out of Phoenix. Food bank, referrals for services, and then we also partner with Southwest Behavioral Health and WIC to provide care to families who need those additional services. We do a couple of other things as well. We're a tax prep site through the VITA program in partnership with the City of Chandler and Mesa United Way, which I know probably some of you on this webinar today are also. And then we do some holiday activities for families and other events, including bringing in the fire department and the police department to do presentations for families, car seat installations, all of those kinds of activities. And this slide kind of talks about some of our ongoing goals for the care center. And really what Kathleen wanted me to talk about was how we approached all of the rapid changes during COVID-19. And I keep joking with my family that if I hear the word pivot one more time, but that's really what all of this has become for so many of us. And so, you know, back in March when it was determined that schools should close, since we are part of the Chandler Unified School District and we're in one of their buildings, our building closed to public services at that time. And what that meant for us was switching to a lot of online services. We started providing our Family Resource Center services via our Facebook page. We have a private group on there that families can join. We also started providing services via WhatsApp, which is a very popular app for a lot of our families to use. Some of our families are not comfortable on Facebook or other social media, so WhatsApp is a more comfortable site for them to use to communicate with us. We kept our food bank open, which has been interesting. Our food bank historically has been pretty much 100% volunteer run. We have a little bit of staffing time, obviously, that goes into it, especially during the holiday season when we're busier, but primarily it was our volunteers who were running it for us. And when we had to shut our building to the public, we had to ask our volunteers to stop coming temporarily. And we're looking forward to having them back because we miss them. But that was a big shift for us to look at what did our food bank service look like. How do we provide that service? It used to be people came in our front door and checked in at our front desk and watched through the entire building. And we had volunteers in the food bank who would help them take their food out. And suddenly we had to shift to families had to come through our back entrance and they couldn't enter our building and we couldn't have volunteers there to help us. We were fortunate, Chandler Unified, like most school districts, really made a concerted effort to make sure that all of their employees could stay employed. And some of that meant giving them tasks that maybe were outside of their normal workday. And so one of the things that we did is worked with our transportation department. Our bus drivers obviously were not busing kids to school. And so in order to help keep them fully employed during the shutdowns, we were able to bring in some bus drivers to help us with that. So it was really, you know, and I know it's been mentioned by Kathleen and a couple other presenters, but the collaboration was really key. Being able to work in creative ways with some of our partners to make sure we were addressing the needs that existed for our families as well as possible. Being able to shift to online platforms, making sure that our staff members were contacting families regularly, reaching out to them, asking them what resources they needed, communicating with them, giving them activities to do with their kids. I have an 11-year-old and a 13-year-old, and you know, when they're bored silly, they can go play a video game or read a book. But when you have a 3-year-old at home bored silly, it's a little bit more challenging. And so it was really important to us to continue to work with those families and provide them resources and avenues for social connection with other parents, as well as education opportunities for their kids. As, of course, the stay-home orders were lifted by the governor, we have looked at reopening our services. One of them that we have already reopened is our immunization clinic because immunizations are a public health issue, obviously. And assuming kids go back to school in July or August, they're going to need to be updated on immunizations. And when the flu shot comes out, we are going to want families to, you know, access that service as well. And so our process has involved meeting with our partners that provide those services. So in that case, Chandler Regional Medical Center, and coming up with a written plan for how we would address some of the concerns, physical distancing for families, who wears masks, you know, how we keep our staff safe, how we keep our volunteers safe, how we keep our partners safe, and of course, how we keep our families safe. And so we've worked through that process with some of our services by developing a written plan that we then take to the district for their approval, because of course it's their building and, you know, we have to worry about whether they're comfortable with what we're doing. And then also utilizing professional networks. So another example is our dental clinic, which reopening a dental clinic after a pandemic is a challenge I never knew I would undertake when I went to school to become a social worker. But it's been interesting, and we've had to look at, you know, what does the American Academy of Pediatric Dentistry recommend, and what does WHO recommend, and the CDC and OSHA. And so it's really been a process of analyzing what are the recommended best practices, what are the ways that we can ensure safety for our families while also making sure that we're providing those vital services that they really have come to depend on. Unfortunately, if you leave a kid in March who needs fillings done, by the time you come back in June or July, you're probably going to have a kid who is close to needing a root canal. Yeah. So we're really trying to be proactive and find ways to creatively address those needs for our community as we move forward. So I know that was a lot of information, but I think just really important to mention, you know, our partnerships have been vital for all of this. We could not do what we have done, and I'm sure every nonprofit here would echo this, without the support of our funders, our donors, the people who want to continue to drop off food at our clinic, even if they can't volunteer, the people who, you know, make sure that we have the support in place, the people who meet with us on a weekly basis to talk about the what ifs and the hypotheticals of reopening, because this is really a situation. Kathleen and I were in a meeting together recently, and I know I said, this is not, nobody prepares for a pandemic. Well, the hospital does. And we're fortunate to partner with them, but really it's not something I think that a lot of nonprofits had plans for. And so I think it's really opened our eyes. And if nothing else, what we will get out of this is I think that we will be so much better prepared, and it will make us really pause and think about how these things are impacting, our families and ourselves and our ability to provide the services that we provide.
Thank you, Katie, so much. Appreciate your time today and your information. I liked also, again, how you talked about it's an ongoing theme. Working with your collaborative partners to figure things out is so important. And oftentimes by having that discussions with your peers on how are you doing it, helps you to be able to figure out how you're going to move forward, whether it be a reopening or how to facilitate food bank in the time of social distancing and masks, etc. So that's really important that we do reach out to our partners, both when we need help, but also how are they doing and what assistance can we provide to them. You alluded to the repurposed work as well. I think a lot of nonprofits, and we are certainly doing it in the hospital as well, in some areas in regards to, well, this is the work that you typically do, but right now we need to cross-train you in this area as well so that we can continue providing our services, whatever they may be. And then also the discussion about what reopening looks like. If you're an outpatient treatment center, the reopening is governed and regulated by many aspects. And so those governing bodies in some cases are also trying to figure out how do you reopen a dental clinic for restorative or a dental clinic for prevention care. And then also paying attention to as the mandates come through locally through the municipalities or from the state, from the governor and nationally, and how you integrate that into the services that you're providing. So thank you for that. And also I think a really important message for the group is that similar to the Heritage Center, the Care Center offers a variety of services that are really important for families at this time that in many circumstances they would be doing well and wouldn't need to access medical care or social services or financial assistance or the food bank, that they're in different circumstances today. And so the availability, whether it be at the Heritage Center or at the Care Center or Matthews Food Bank or wherever it may be in our communities, is so important. And again, I think that goes back to how we need to support each other during this time so that the services can continue. And so thank you for that, Katie. Appreciate it very much. And now we're going to move to Donna Martin, who is the Volunteer Services Manager for the Boys and Girls Club. Thank you so much for being on the call today, Donna. And Donna's going to talk about transition during COVID-19 as well in regards to volunteerism and operations at Boys and Girls Club. So thank you. And we're ready.
Thank you, Kathleen, and I appreciate this opportunity to share with everyone some of the pivoting we've had to do, sometimes hour by hour, not just day by day. I did prepare slides, and we'll see if this will work. Just give me a second to load them up. See if we can get it in presentation mode. All right, so hopefully you're seeing my first slide and not the entire presenter's mode. But anyways, we're just going to move forward with this. So I want to talk about virtual volunteering and what Boys and Girls Clubs of the Valley has done just since February to welcome volunteers in as those supportive adult relationships that we know kids need. And for those of you that aren't familiar with our mission, we serve the kids that need us most to become caring, productive, responsible community members by providing premier out-of-school time programs and activities. So first I wanted to make sure that we all understood that virtual volunteering is not new. It's been around for a very long time. And within the profession of volunteer administration, Craven and Ellis have given us what I consider the best definition, and that's using the internet or a computer, a telecenter, or even your smartphone to connect and do work. So think about it as telecommuting, but for volunteers. And so we had a really tight time frame. So in January, before locally we heard much about COVID-19, Boys and Girls Clubs of the East Valley and Boys and Girls Clubs of Metro Phoenix merged, and we emerged as a new organization, the Boys and Girls Clubs of the Valley, Arizona. And with that potential, we merged with more than 2,000 volunteers. So that's in January, and that's a pretty healthy number. In February, I got my first phone call from one of our corporate partners canceling their group activity. And at the time I thought, oh, that's a little weird, but they're an international firm, and I'm sure that all of their branches across the world are having these same considerations, because generally corporations, when they engage in community outreach, it's pretty much standardized across all of their branch locations. So I wasn't too surprised, but I thought, that's interesting. Well, by the time we got to March 1st, we'd had many more group canceling, and we were starting to hear from some of our university and college partners that their students would probably be leaving us and going home for spring break and may not be returning. So in March, during the spring break transitions that most school districts went to, our clubs also went through a transition time where we became more focused on staying open to serve the families of the first responders and the essential workers. And with that, it meant that we really needed to limit the number of adults coming into the club so that we weren't putting the kids at any greater risk. So our club volunteers at that point were no longer coming into the club. And at the very same time, our first request came from a very large corporate partner. They had sent all of their workers home for telecommuting and virtual work, but they wanted to keep them engaged in the community. So could we please come up with some volunteer opportunities? And that was when the light bulb went on. That's when our organization realized the best way to encourage folks to continue staying connected with us was going to be as virtual volunteers. So it's not new, and we're a service enterprise organization, which means that we've embedded volunteers across the organization. So we kind of thought we knew what we were doing with virtual volunteering, but it was really limited. And we had to revision what would it look like in the club space. And really what folks wanted to do was engage with the kids, just like they did when they came in the club. So what would that look like? So within a week, we had pivoted and reimagined all of our club volunteer opportunities so that they could be done virtual. And that included reconsidering policy, practice, the language that we use, finding the folks to do it with. And then in the first week of April, we rolled out those initial opportunities. We partnered with community partners that had either requested these opportunities specifically, or were folks that we knew were open to trying out new things. We kept it small. We worked with the folks that we knew so we could work out the kinks and still have fun with it. You don't want to try out something new with someone who doesn't know you well, and if it blows up in your face, then they have a sour experience. So really figuring out those collaborations is really key to being successful. So all through April, we engaged volunteers virtually. We created a Zoom space. We maintained control because remember, we're working with the kiddos. And we figured out ways where we could have groups of up to 3 engage with the kids via Zoom in that virtual space and have fun, and everyone learned something and have that connection going. And it worked. And so in May, we found out that it was now time to think about, okay, the initial rollout worked. We've learned a few things. How do we tweak this and continue to improve it so that when we get to the summer program, we hopefully will welcome back the in-person, but the virtual volunteer opportunities were popular. And I realized they're not going to go away, nor should they. Because the 2 key things that came out of all this was we were able to continue to provide the kids with those supportive relationships and bring really new opportunities, experiences to the kids. But also, we were seeing volunteers that we ordinarily wouldn't see in the clubs for a variety of reasons. We had folks volunteering with us in Ohio and Germany. We could not have had that before. So it really broadened our volunteer base in ways that even we hadn't anticipated. Then on June 8th, in line with the changes in sheltering at home and other safety precautions and protocols, we began welcoming volunteers back into the clubs in person. We're very careful about this because we want to keep the kids protected, and we also want to protect the volunteers. So we're not actively recruiting new volunteers. We're working with our current volunteers and folks that I say just happen to find us. So maybe they go on our website, maybe they have a kid in the club and they want to participate as well, or maybe they have service learning requirements they have to meet for their online college classes. So there's still a need out there, and we're still trying to meet that need, but we're not actively recruiting because we're still transitioning. So in the month of July, we'll be looking at those virtual volunteer opportunities for fall and what will those look like. And what we've already heard from some of our partners is that Maricopa Community College District will maintain their online requirements. So those students will need online service opportunities. Arizona State University is planning to do a slow rollout with in-person classes, but they've also now added ASU Sync. And so that changes their virtual service requirements. So it's a dynamic time, pretty exciting stuff. And what we've learned is don't guess. So we thought we knew our available technology, and we thought we knew our employees had the skills, and we thought the volunteers were comfortable, but we discovered not necessarily true. Just because you know how to do a Zoom phone call like this doesn't necessarily mean you're ready to Zoom in with a group of 10 kids. We also discovered through a series of interesting lessons, you need to know your bandwidth. And I don't just mean the bandwidth for the technology, but your own abilities. What can you manage? How many projects can you take on? What is your day going to look like? And if you're going to commit to doing 3 30-minute sessions and Zoom, you need to schedule lunch in somewhere, somehow. We also learn to use intentional vocabulary. So while we might have virtual volunteer opportunities, we do not have virtual volunteers because volunteers are real in the flesh people. They may choose to volunteer through an internet connection, or they may choose to volunteer in person, but they're still real people volunteering. And I learned early on to use really clear language, specifically with our staff. So when we started talking about virtual volunteering, we had to find some vocabulary that was going to work for us. And then lastly, scale intentionally, think it out, be thoughtful, engage with trusted partners and volunteers so that if things go sideways, there's no hard feelings and everyone has good grace and good humor and acknowledges, oh, okay, that didn't work so well. What can we do next? So those are the lessons that we've learned. I'm looking forward to the fall, and I'm looking forward to figuring out how to make these virtual opportunities still as enriching and rewarding as folks find the in-person opportunity. So again, thank you for letting us share this information with you today.
Thank you so much, Donna. What great information. The virtual volunteering is something that I think everyone should be tapping into to some degree. And I really liked how you put that slide up on no guesswork. Certainly that saves a lot of time and unnecessary effort when you try and do something and haven't really thought it through. And the bandwidth is important because we've got to have the ability and the capabilities to do what we would like to. So thinking about bandwidth is important, and obviously communication is always important as well. I always like to say, have a plan B. If plan A doesn't work, what's your plan B, and thinking through that. So thank you so very much. It's great to see how the Boys and Girls Club is reinventing themselves, and even during the time of COVID, how to create a way of providing important services. And I love how you're helping the first responders families as well. That's really impressive. Thank you again for your presentation. We are going to now move on to Tyson Nansel, Director of External Affairs for United Food Bank, giving us an understanding of how they're working through COVID-19 with their volunteers and their operations. Are you ready, Tyson?
Yes, I'm ready. And I want to say thank you to all the other presenters and everyone. I mean, you are doing fabulous work and getting through these uncertain times. So great job. Let me see if I can share my screen here. All right, so when this all really started back in March, when the stay-at-home order happened, but the state of emergency as well, we started noticing all of our corporate volunteer groups cancel on us, as well as schools, because then schools, students were going to school anymore, and then church groups as well. At United Food Bank, we have kind of a threefold volunteer events that we do for groups. And before, in a day, we could have groups of nearly 80, 70 to 60 people coming through. And we would hold our volunteer events in the morning between 9 and 11, and then in the evening between 6 and 8. And we still do those volunteer events, but because of the pandemic and taking every precaution as possible for safety and not spread germs within our warehouse, we've had to decrease our numbers quite a lot. When all those groups canceled, we were scrambling to get volunteers because we needed to continue assembling emergency food bags. So the three items that we do for our volunteer groups is, the first one is assembling emergency food bags. These food bags contain a number of different items in them, such as non-perishable food, cans of meat, cans of fruit, a bottle of juice, a lot of different things. And we have to put together 21,000 of those a month. They go to our more than 20,000 square mile service area in the East Valley in Eastern Arizona. The second volunteer event that we do is something called, is a food sort. And so when food drives come in, we would do food sorting, and we would look through those items, make sure they're not expired, dented, and then we'd put them into our food boxes, and then we'd send it out to our agencies. And then the third thing that we would do would be our food distribution. And that was on a Friday. And we would do that from 8 in the morning to about noon. Well, when the pandemic really hit Arizona, we watched our average number of about 550 families, 600 families. That jumped to 1,200 families within a week. And then we saw 1,200 families jump up to 2,500 families the following week. And that's nearly about 10,000 individuals that we are serving at a time. And so volunteers are the lifeblood of the food bank to put those food boxes together, put those emergency food bags together. And so we started taking every safety precaution as possible, following the CDC guidelines, following what our hospitals are saying. And it's wearing gloves, social distancing at 6 feet, and wearing masks as well. And then we also started doing temperature checks when volunteers come in. And we've had to turn a few people away that had a 100-degree temp or a little bit more. And it's like, hey, you gotta go. We can't have you here. Go call someone. But safety was our #1 priority, and still is at our food bank. It was before. It was ensuring that everyone's safe and hydrated, but now it's taking that step further to now not spread germs within our warehouse and making sure that our volunteers come in, that they're safe, and they leave knowing that they gave back to the community, but they came and had fun still, but they were safe while doing it. So I talked a little bit about our distribution, and I have a few pictures to kind of show what it was like. Our distribution used to be at our volunteer center in Mesa, off of Mesa Drive, just south of the 60. We got too big for that. And we had to move our distribution to the Mesa Convention Center, which has a very large parking lot. It's pretty central to where the number of our people we are serving are coming from the Mesa, Phoenix, Tempe area, Gilbert, Chandler as well. And like I said, we jumped from about 1,200 families, so that's about 2,000, 3,000 individuals, to up to 10,000 individuals on a Friday. And then that turned into a Friday distribution to a Wednesday distribution as well. So we went from 1 day a week to 2 days a week. And that was just to meet that demand. We saw that increase. We saw the surge of the number of people coming to our distribution. And then we started talking to a lot of them, again, wearing face masks, gloves, and asking them, why are you in line? And a lot of it is because they lost their job.
Yeah.
And so watching those numbers, continuing to watch is the increase of unemployment still happening. And we will continue to watch, hey, like, can we scale back yet? Or do we still need to provide this much food to the number of people coming to our distribution? And what happened with that is that it actually grew. We've been going out to the White Mountain Apache Indian Reservation, and we've done 2 mobile distributions out there in the last couple months. If you know, there's a report that just came out that Indian reservation now has the highest case rate or number of case rate per capita within their location with that population. So the need is still great, and it's still there, not just here in the Valley and in our local communities, but in our rural communities as well. So how can you help United Food Bank? Well, I talked about volunteering, but we've scaled back the requests of volunteers right now, because in our warehouse where, like I said, we could hold 30 people at a time, so 2 volunteer shifts, that's about 60 people. We've scaled that back to about 15 to 20 people, just so we could practice social distancing. And when we were scrambling to get volunteers, I mean, we were getting them just like that. Families were coming and volunteering, and they filled up our volunteer spots. I mean, in June, we were still pretty full. We had to open to July to get those open. So we get asked, well, what else can I do? So food drives are a big thing for us right now, because along with the volunteers, food drives canceled on us. And where food drives matters, where we can get community involved, businesses, schools involved, where a lot of people are in one area that can donate food. And so what was amazing was that the town of Gilbert recently held a Gilbert Feeding Families food drive. It benefited United Food Bank, Matthews Crossings. I'm going to miss a few, Ascend in Gilbert, but a few other food banks that were able to benefit from this food drive. And collectively, we raised nearly $30,000, but more importantly, we also raised 120,000 pounds of food. And that was over a 3-day span in just a weekend. So it was incredible. So non-perishable food items you see in this picture, water bottles, cereal, peanut butter, non-perishable food items, canned fruit, canned meat. Those are items that have a long shelf life, but also can fill an empty belly, especially if it's a family. Now that school's out, we've heard a lot of schools aren't giving their food out anymore like they were at the curbside. And that's okay. We understand that happens because it happens every summer. So summer is a very busy time for United Food Bank and all food banks in trying to get food to families, especially right now with kids not being in school or not getting that food from the schools anymore. So food drives are big. If you can go to your local food bank, you can donate food or volunteer, but these are just some of the adjustments we've had to make because of the pandemic.
Thank you so much.
Take any questions, but I do have a video that I'd like to show you. It's just a 2-minute video just to see where we have gone because of what's been going on.
Is the video supposed to be playing?
Oh, is it not playing?
No.
Oh, I've been sitting here for like 20 seconds thinking you're watching a video. You don't see a video?
No. We may have to submit it with the
Tyson,
I'll do that.
make sure you're screen sharing the video because you had your slides are still screen share.
Do you have sound with it?
All right, it looks like I'll have to share share the link then. There's no sound with that?
Yeah.
All right, no worries.
Okay, well, thank you. I'm sure
Okay.
we'll get to see it after the session today. So thank you for sharing. I appreciate that you brought up the increase in need for up to 10,000 individuals, from going from to 2,500 per week and a total of 10,000 individuals. Again, that's a testimonial to the need, the significant need we have right now. So I appreciate you bringing that up, and the amount of work that must go into serving that many people. Your picture really demonstrates in itself that huge parking lot filled with cars demonstrates the great need during this time, and how you were using the important practices to reduce the potential for infection with the gloves, the masking, and the social distancing. Several agencies have, while we say we want a lot of volunteers, we also realize that with social distancing, you need less volunteers, so to speak, from that perspective. So I appreciate that. And that you were also serving the Navajo Nation, which is so very important. And at the end of the day, one of the most basic items that people need whenever they lose their jobs and they can't pay the bills and they're struggling is food. So getting that food out to individuals is so important. So thank you very much for your work in that space. Appreciate it so much. So now we have the session open for questions for the group. So you can raise your hand, or you may have already submitted to Sarah through the chat. And I know I had one question for Jessica to tell us a little bit how she moved into a creative space for providing her services with domestic violence, if she had a moment to share that.
Yeah, sure. And I'm sorry, my picture's not working. I had a plan B for when my computer didn't work, and plan B does not have a photo, my video. So it has been really actually difficult and a little bit dangerous sometimes for us, the way we've had to communicate, because some of our victims who are still home with their abusers, we're trying to communicate with them, like for example, via text. So we've had to be really creative, which we've done before, but we've just had to do it to excess now.
Yeah.
Very creative about words we use when we're talking to them. And so that's been a little extra challenge for us in doing that. But yeah, we've definitely had to be more creative in our communications with them. We've been doing things like giving a lot more books and finding creative ways to meet them. For our sexual abuse survivors who we know are no longer in danger, we've had people pick things up from our homes even during this time, just because I want them to get the resources they need. And then we actually just had to change programs because we lost so much funding, but we were paying for therapy. What we found happened was with everybody being home, they were seeing their therapists even more often. And because all of our therapists were providing teletherapy, those numbers increased and our bills as a result increased. So the good news was they ended up being able to get more services. We just can't pay for as many as were coming in, but that's still going on.
Thank you. Thank you so much. Sarah, Melanie, are there other questions that have come through?
I don't have any other questions that haven't already been answered by panelists.
So we're finding creative ways to help them now. We saw that skyrocket.
So before we close the call, I just want to do a double check on if there were any more questions from the group. Raise your hand if you have an additional question for our presenters. All of the information that they presented today you'll receive after the call, and also the recording will be available for you to listen to at a later time as well. And I am so appreciative of our panelists and their expertise and the services that they're providing to the community, and just keep up the good work and reach out to your peers when you need assistance. And we all recognize what a difficult time we're in, and what a more difficult time we would be in have you not been able to continue your services and provide them via virtual platforms or other guidelines to be safe while you're providing your services.
Kathleen, we do have one question from
Sure.
Mike.
Mm-hmm.
Mike, you're unmuted.
Mike, you have a question? Mike, you're unmuted. Can you respond to your question, please?
Looks like he's not there.
Okay. All right. Well, thank you everyone for your time today. We appreciate it very much. If you have a specific topic that you would like us to bring to the next town hall, please email us or contact us and let us know so that we can focus on topics that are relevant and important to you. And if you have, in your efforts to sustain your organization, completed a virtual fundraising event, we would like to know if you'd be willing to present that at an upcoming call as well. So again, we want to be able to have folks present on fundraising during this time. If you've already completed a virtual event and have some great lessons learned and opportunities, let us know. Thank you so much. Have a wonderful and safe week. God bless.
Thank you, Kathleen.
Thanks, Kathleen.